Hi, Dr. Michael Miyazaki. What we're going to talk about is scores. And I want you to think about how we might be able to use scores more in our office because scores are important. And when you look at the reasons why, they motivate us. We take something that's fuzzy and we make it clear. We can compare before and after. We can even create like a contest. It's winnable. It gives us clarity. It has instant meaning. If I say I went golfing and I shot a 110, which is low for me, versus shooting a 68, we automatically know was it good or bad. If I'm shooting 110 and I want to make progress, then I'm going to set my target as at 68 and I'm going to gradually try to get there and I'm going to track my improvement. And because I have that target, it's going to help me improve even more, right? Because if I know I'm getting close to my target, if I'm shooting, let's say, from 110 down to an 80, I know I'm getting closer. And so we get that goal grading effect, which just means as we get closer, we work even harder because now we can taste that victory. It gives us some feedback, right? If I go out and I shoot 110 one day and then I shoot a 80 the next day and then I'm back up to 115, it just gives me some feedback. You know, is it my form? Is it my club? Is it the weather? Is it mental? And it gives us social proof and accountability. You know, if I say I'm going to go from 110 down to 68, and I tell my friends that that's what I want to do, then I'm going to be accountable. I'm going to practice more. I'm going to maybe take lessons and get better equipment. And then it's going to support that decision. You know, maybe I go from 110 down to 100. And at 100, I decide, well, now I deserve a new golf shirt or maybe a new putter. And it gives us a way to kind of work our way towards that goal. So the score, and the score could be different. It could be a number, it could be a time, it could be a target. But when we know the score to whatever that goal is that we're trying to attain, it helps us. It helps us stay focused and it helps to motivate us. Now, those that we take care of, our patients, they behave the same way. And so what we're trying to do these days is we're trying to put scores behind a lot of what we, that score is so important. So actually, I'm teaching a course coming up. It's an occlusion course, and I'm trying to get doctors to understand how occlusion is so important to what we do in our daily practice. So I sent this out to them today, just saying, ask your patients a couple quick questions. Do you wake up with symptoms like your jaws are tight? Do you feel like you've been clenching all night? And then look at the visual cues. Is there a lot of wear? Are there abfractions, recession, scalping of the tongue, chipped crowns or veneers? And then take some photos, and then we give this a score. If it's a low score, 0 to 2, then it's low risk. And we just tell the patient, you know, we'll keep an eye on the wear and tear that's going on. Maybe they've got some wear on the posterior teeth. If it's higher, like a 6+, then the doctor should take a close look. Maybe even get the patient back and say, you know, there's a lot of signs that you're going to break teeth. You're going to wear them down some more. And so we should really sit down and figure out how we might be able to stop that. And there could be various ways of doing that. So I call that the occlusion risk score, right? So we give them a score. A low score is good. A high score is going to be bad. And if they've got that high score, we want to make them aware of that. Some of the past presentations I've been talking to about where we use what we call MCA and we're measuring biofilm or just the fluorescence of the teeth, we can tell and keep a score of how mineralized the teeth are or how much bacteria is around the teeth because that can predict where things are going to get worse. So again, we have a score. We have what we call a 2 score where we actually can look, in this case, at the fluorescence. Green is good, red is bad. When I'm looking at occlusion, I'm actually scoring my patients. I have a numeric score. I don't just tell them, well, your jaw seems to be better, or your muscles seem to be getting worse. What we do is we measure microvolts. And as the patient's functioning, we can actually measure and give the patient a score. And what we're doing is we're measuring the muscle activity of, in this case, 4 pairs of muscle groups. And I think, again, it just helps us communicate to the patient that you're not in such good shape. And as we go through treatment, you're getting better, or if you're not getting better, let's figure out why. For ParaProtect users, we have what's called the gum score. And we ask our patients, do you know your number? And that's the bleeding point number. So you might have 100 bleeding points, which would be bad. That just means, again, that those areas are more likely to have periodontal disease. And what we want to do is we want to treat the patient either through some instrumentation or the use of ParaProtect trays and the Paragel to bring that score down by controlling the biofilm. So again, we try to communicate to our patients that a low score is better. So if you've got a high bleeding score of, let's say, 50, we'd like to get you to be 10 or below, or ultimately down to 0. But again, we give the patient a score so they know, are they doing good? Are they doing not so good? And are they making progress to be better? We talked about the indicator. One of the things about the indicator is that if we are doing a root canal and before we obturate, if there's still a lot of bacteria or ATP is what the indicator indicates, but there's a lot of debris, biodebris inside of that canal, and we obturate it, there's a higher chance that that tooth will not heal up. So when they compare the success rates of the endodontists are in the high 90% and the GPs are around 80% or lower sometimes, what it is maybe we're not cleaning the teeth out well. And if we don't clean the teeth out well, then it involves maybe a retreatment and, if anything, just a loss of confidence the patients have in us because we haven't made them better. So we have our endoscore. And by having an endoscore, we stop guessing because we can measure the levels of biodebris inside the canals by the ATP value. And we know that the lower the score, the better. So I have my endoscore where I rinse out the canal after we've done our instrumentation and our irrigation. We rinse the canals out with some sterile water. Then we draw off some of that sterile water and we test it inside our indicator. A score of 1 to 25, that means there's very low levels of bioburden. We're most likely going to be okay if we obturate the canals at that point. If we're 50 or above, that means we're high bioburden. And the recommendation would be maybe not to obturate yet, but to go back in, maybe instrument some more, maybe irrigate some more, and then test the canals one more time. So again, we've got our scores, and the scores are so important to us in dentistry today because it gives us a way to communicate with our colleagues, a way for us to communicate with our patients. And again, the scores just keep us on track. They let us know, are we doing better or are we doing worse? So remember, try to communicate with your patients in scores. So what I would like you to do is think about how you could use scores perhaps more in your dental practice. Maybe it's with your team. You have goals for every day, maybe every week, every month, and we know we can track. It keeps everybody focused and motivated. With our patients, we have to figure out ways that we can score their clinical progress to keep them motivated and to help them understand what it is that we're looking at. So anyway, I just think it's very interesting because during these times, we are coming out with better tests, and these tests are allowing us to quantify where our patients are. And that's, I think, going to be a more powerful tool as we move in the future, especially with AI being able to show us more. And as we quantify, it's going to be very powerful. So anyway, I want you to think about that, and I will see you during the next episode. Thank you very much.